Hello, and welcome today to South Central Kansas Living on KGPT Channel 49 with Rick Loreno. That's me. Today's topic is important to every baby boomer alive. And there's about 10,000 of us every day that are going to turn 65. When you turn 65, you're going to make an important decision about your health care and what you're going to use for health care in the future. It's called Medicare. And all of us are going to be making that decision, or we're going to have Medicaid, which is the poor folks' alternative to Medicare. And those programs have been set up to help take care of the elderly and their medical needs as they go forward. Now, most of us have had insurance provided by an employer or the government, or we've paid for it ourselves most of our lives. But at 65, a large portion of our medical care is going to be taken over by Medicare. And you're going to receive a book in the mail. The book is kind of like this, and every year you're going to get one, and you'll get it about 2 months before you have to make a decision as to what kind of care you're going to have. And the care that you're choosing is the supplemental care, and it's sold by insurance companies. And remember, insurance companies are in business for the most part to make a profit. And they have agents, and they have brokers, and they have people that they pay to operate those insurance programs. I have with me today David Powell. Now, David is an insurance broker and agent, and he's been in the insurance business for over 30 years. He's one of the few people that I know that have read the new health care bill that's commonly referred to as Obamacare. He's read all 1,900 and some odd pages of that piece of legislation. And David has run for insurance commission in the past, and he's going to make an announcement today on our program about his run for the insurance commissioner here in the state of Kansas once again. So without any further ado, let's get into today's topic. Today's topic, Medicare and you, and what you need to know to help you make those decisions.
Presenting from the Great Plains Television Studios in Wichita, Kansas, Kansas Living with Rick Loreno. We'll be right back.
Welcome back to South Central Kansas Living, and with me now is David Powell. Hi, Dave. How are you?
Doing fine.
We've known each other for a long time, all the way back to the days when we both taught high school at El Dorado. So that's going back over 40 years.
Yeah, that's back in the 70s.
What exactly is your title, and how do you get involved in this whole insurance rigmarole with Medicare?
Well, I went into the insurance business 37 years ago now.
Wow, that's
and so it's been a while. And I use my teaching background to help people understand what they're dealing with, what we can do to help them. And with Medicare, there's a lot of questions.
I spent over 100 hours reading and researching and fretting over this decision because it has an impact on each individual.
And for the average person, maybe that isn't internet savvy, can't get on and look at the different websites like Medicare.gov. Everybody needs to make educated decisions. When I got into the insurance business, I decided don't just stop as an agent. I have 4 different degrees in insurance.
What I'm hearing from you is that education is important and that everybody's unique and different. So you almost have to deal one-on-one.
Well, Medicare A and B are pretty well cut and dry. The choices beyond that are complicated, or can be. They're as simple as using a pencil and paper to figure the numbers out. You know, I used to teach math in high school,
Yes.
And math is really important in this decision. How many dollars am I spending? What is my health like? What can I expect to spend? We have 3 or 4 different choices. If you just take Medicare Part A and B and don't take a supplement.
Now that's an option. You can just take A and B
and nothing else.
And nothing. Well, don't you have to sign up for D though as well?
Well, you don't even have to sign up for B. Okay.
Oh, really?
Part A, when you got your paycheck and it said MED and they took money out of your paycheck every month and you said, gee, what are they paying for? That's Part A of Medicare.
And that's the hospitalization side.
That's the hospitalization. Part B is the doctor.
Right.
Okay. Part D is the prescriptions.
Right.
All right. If you're never going to a doctor and you're not taking any prescriptions, why do I want to spend $104 when I turn 65 to get Part B of Medicare? Why do I want to spend $20, $25, $30, $100, whatever, on a prescription Plan D? Well, if you don't take them when you're first eligible, there's a penalty.
What's the penalty? Now,
that'll vary by how long it is between the time you're first eligible and the time you finally sign up. There are people who don't sign up for Part B until they're 71 years old. I just had a man do that. But he's been working for somebody that has provided qualified health plan that meet all the requirements of having the proper coverage. He doesn't pay the Part B penalty. He doesn't pay a Part D penalty. If that employer had been providing a health savings account type, the high deductible
policies,
without first dollar benefits like prescriptions, and everything counts towards meeting that deductible, that doesn't meet the Part D qualification as being equivalent, essentially, to what you're supposed to have.
So there's a lot of rules and regulations.
Absolutely. You have somebody that finally signs up for Part D when they're 67 or 68 because they don't take any prescriptions. Why do I want to spend $20, $25 a month for something that I'm not using?
Right.
Well, it's a placeholder. So you go out and you find the cheapest Part D that you can buy anywhere in your area, and you buy it just to hold the place. The penalty is 1% of the average cost of a Part D program nationwide, and you pay that 1% for every month that you didn't have a qualifying plan. So what does that mean? How long does that last? It's for the rest of your life.
So you would have been better off getting some kind of a placeholder.
Absolutely.
Yeah. I went to the internet, I read the book that they sent me, and did a lot of that research on my own. And then I finally called Coventry, which is my carrier, and asked them what I needed to do to sign up. And they sent me out a little PowerPoint presentation which ran, I don't know, about 30-some pages, 36 pages, and I kind of signed myself up.
Every year, the federal government has set up a special time from October 15th to December 7th every year, and that's called your annual election period.
Okay.
For somebody who's just aging in, you have a initial enrollment period or initial election period, which runs 3 months before you turn 65, the month of, and 3 months after. For somebody that, say, worked out at Spirit or Boeing or whatever, and they're over age 65, never took Plan B, they have a special election period. So there's lots of different opportunities. I hold seminars every year. This last year we had probably 500 people come to our seminars.
Are those seminars free?
Oh, yeah. Yeah, and they're advertised.
Okay.
You can call Coventry. You can call any number of places. They can call me. I'll be glad to
and we'll put up your contact information if people would like to contact you.
CMS has rules now that are designed to protect seniors.
Okay.
And one of those rules is I can't call somebody. I had a doctor call me the other day and said, I've got a patient, 69 years old. She wants to look at changing her plan. Can you call her? I said, no, I can't. The rules are that they have to contact me, and then I have to have them sign a scope of appointment, meaning this is what we're going to talk about. We have to wait 48 hours after that, and then I can sit down and visit with them.
Wow.
If they come to a seminar, we don't have to go through all that, but in the seminar I still have them sign a scope of appointment and then we set up a time when we can visit one-on-one. No.
You need the one-on-one time, which that's pretty time consuming when you consider the fact that there's 10,000 baby boomers every day reaching the magic age. For the next 19 years, insurance agents are going to have a lot of people to talk to.
I'm not getting all those 10,000 myself, but a lot of it's by word of mouth. I've worked with somebody, hey, yeah, Dave Powell, I worked with him when I turned 65. You really need to visit. I want people to make educated decisions, because when you're choosing what you're going to have go along with Medicare, there's a lot of options.
I chose an Advantage plan, an HMO Advantage plan, and I know that there are penalties should I happen to change that plan after I've been in it 12 months or more. And can you tell us a little bit about what some of the penalties are? What happens if I make a change?
There's two other choices. I mean, not doing anything, just staying with A.
Okay.
Taking B, not doing anything besides that, taking a Medigap plan, or taking an Advantage plan. Okay, an Advantage plan is very much like traditional health insurance that you may have just come off of. You've got deductibles and office call copays and so forth. The prescription plan D is just pretty much like the prescription plans you've had at work. You have a copay for brand name and non-formulary and the generics and so forth. So we really don't get into comparing those as much. But the Advantage plans generally are very low in premium, may not have any premium. If you live in the rural areas of the state, you're probably,
may not be available,
or they'll have a premium and copays. The Advantage plan, basically the first year you're on an Advantage plan, you can basically kick the tires. You have a free look. You get to go through the whole 12 months, and then you say, okay, this isn't working for me. I have lots of medical expenses. I'm hitting a lot of copays. I'm spending more than what I would have if I just paid a premium and had everything covered. You got to remember, on the gap plans, there's not just one. There's the alphabet A through
yeah,
N.
I know.
Okay. And they've changed some of them. They've taken away the I's and J's that used to exist. And so you choose something out of there. Well, again, you got to be very careful. How much do you want covered? A plan F or a plan G, and they're very much almost the same.
Right.
The difference is on the G, you have a deductible for the doctor that you don't have on the F. But if you look at the chart and you look down F, okay, this is what Medicare covers, and then the next column is what you're responsible for, and then the third column is what is paid by the insurance company, and so what do you have left? An F, you've got about $1,200 deductible on Part A of Medicare, the hospital part, and so the Plan F covers that deductible, and what are you left with? Zero. Okay? And that premium will vary from company to company. It could be down in the low 100s. It could be upwards of $200, even for a 65-year-old. The thing that affects the rates for Medicare supplements are basically three things. Number one, your age, and we want to have that keep going up every year. We want to still be alive.
That's right.
Number two, how long has that plan been in the marketplace?
After the break, David has an important announcement.
That's an important point, that every year when I age up, I'm probably looking at spending more money.
Oh, absolutely.
And Medicare is not free. I mean, anybody that's on it realizes that on a quarterly basis, you pay a Medicare Part B.
Plus you have the premium for
the supplement.
The supplement, plus you have a premium for the prescription plan D.
And that can add up to quite a bit.
When you compare it to, well, when I was 60 or 63 and I was on XYZ company, it was cost me $800-900 a month to have a traditional plan with prescriptions. And now you're only paying $200 a month, and you got everything covered, and the only thing you're left is paying copays on the prescriptions. That seems like a winning situation. But then when you compare them to the Advantage plans, you say, well, I'm not spending anything. I don't take medicines. I'm not seeing a doctor. I go once or twice a year for a physical, and that's covered 100% anymore on all the plans. So why do I want to spend any money? So you look at Advantage plans. Let's say you develop some health issues 2 or 3 years down the road, and now I want to move back to a gap plan, or a supplement plan. The way the law or the way the plans are now, you have to answer a series of health questions, and they don't have to take you back. Kind of a gray area what's going to happen with the new health care law, whether those questions are going to be thrown out or not. If they're thrown out, those rates will go up dramatically, because now insurance companies have to take you and give you all that coverage,
whether they like it or not, and
whether
you're going to use it.
And your rates are going to have to go up to compensate for it.
And they all of the insurance companies have been saying lately that those rates are probably going to go up based on the new law in 2010. And I know you're one of the few people who've read the
Patient Protection and Affordability Care Act is what it's technically called. The president himself referred to it as Obamacare during the debates. And I've actually written a book on it. Yes, I've read it.
You're pretty knowledgeable, and I know you've run for insurance commissioner here in the state of Kansas at least once, I think twice. And do you have anything you want to tell us about the future?
Well, I foresee a lot of problems coming down with the health care law. Senator Backus said the other day, last week, that it's a train wreck waiting to happen. When you look at that and you just simply think about the fact they're collecting taxes for 10 years to pay for the first 6 years of it, as a math major, I ask, what happens at the 10th year?
Yeah. When we run out of money, where do we go next?
Absolutely. All the taxes in it. It's just not sustainable. Is it a good idea to try to reform our health care? Yes. I've even worked with our legislature this year currently, to help try to design some plans that will allow people to buy cheaper insurance. And I am running for office again in 2014.
So in 2014, you plan to run for state insurance commissioner. That's a big announcement. You've heard it here on KGPT Channel 49 that David Powell is a candidate, or will be a candidate, for insurance commissioner for the state of Kansas. And that's something important. We're going to take a break, and we'll be right back. Dave, I know there's such a thing as a high deductible plan or something.
There's a high deductible plan F. Like I said, you have plans between A and N to choose from. And we talked about the F and the G, which are right in the middle, and they take care of pretty much everything. Well, there's a plan called high deductible F. You have to pay the first roughly $2,100 out of pocket, and then it covers everything else. When you stop and think a minute, compared to, say,
$2,100 is less than my out-of-pocket on the Advantage plan.
Your Advantage plan has a worst-case scenario, a couple of $1,000, maybe $3,500 could be for if you're in a PPO. Well, this one stops at the $2,100, and the premium on it for a person our age, $35 a month.
Well, what about 10 years from now? I mean, I know these premiums all go up.
Well, if you were to buy it and you could qualify for it at age 76, that same plan is $40 a month. So it hasn't gone up much in 10 years.
Wow.
Yes, you're responsible for all those costs until you hit that roughly $2,100. But after that, everything's taken care of. And you and I both know, you walk through the door of a hospital, you've already blown through that.
It doesn't take much to run up a big bill in the hospital. How about doctor's office visits?
Everything is covered just like a Plan F. If you have a Plan F, again, you look at the 3 columns, you look at that third column, Yours is all zero. Again, going to the doctor, going in the hospital, having a surgery, those are all part of the $2,100. And it doesn't make any difference how you meet it. You have a surgery.
It's not illness specific, it's annual.
$2,100 a year. It's actually a little less than that. And like everything else that's gone up, I can remember when it was about $1,700 or $1,800.
Okay.
But today it's just shy of $2,100. In a couple of years, it'll probably be a little bit more than that. But the point is, you look at what you're doing,
Right.
and your worst case scenario, you have heart bypass. What are you going to spend? Under your current plan, you'd spend more.
I know you brought with you some of the charts that are in the book and that are available on the internet, and people can go to the internet, they can read their book, and they can get themselves educated. I want you to spend just a couple of minutes, though, and go over some of those charts and things that are available, just in general terms.
The charts you'll see will show all the different things A through N. And then you're going to have a chart that shows a side-by-side comparison of a Plan F and a Plan G. You'll see a chart that actually breaks out what Medicare is. Medicare Part A is the hospital, B is the doctor, C is actually the Advantage plans, and D is the prescription.
Okay.
Now, in the C plan, you'll also notice that a lot of the Advantage plans also offer you Plan C, the prescription, or D. The prescription,
right.
included
Right.
as a part of the package. A Plan C actually replaces Part A, B, and D, and encompasses it all in an Advantage plan. You'll only need to use the company's card, like in your case, Coventry, for your A, B, your kind of like a supplement because it's going to take care of everything but your copays,
Right.
and your prescription plan all rolled into one. So again, making educated decisions, you want to sit down with an agent who knows Medicare and knows the options that you have. You can put pencil and paper. That agent should ask you, what do you have that you think you're going to be spending money on? They're not allowed to guide you in terms of making a definitive decision.
They can't
but
make
they
the
want
decision.
you to think about what you're doing and what you're going to spend money on, and then you weigh and balance.
So often, insurance companies here in Kansas, anyway, the rookie agent is the guy that gets to go make the calls for Medicare insurance.
And there are a lot of people. I know the people that put on most of the Advantage seminars out there. They're required to go through some very intensive training in order to be licensed, and that has to be repeated every year. It can be 10, 12, 14 hours of study and testing. You have to pass at a 90% level in order to be able to work with that product. That isn't the case in the Medicare supplement areas.
Okay.
So you want to make sure you're dealing with somebody who is licensed with several different companies and can help you.
Knows the products.
There's a big difference between Advantage plans, between supplements. Pricing is not the only thing that you have to worry about. You have Advantage plans that cover more medications than other Advantage plans.
Right. The average person today takes about 5 different medications when they're in their 60s.
But then you got the person out there that says, I don't take anything, I'm not going to buy it, and they wind up getting caught up with a penalty. You know, you priced this Plan D to me at $36 a month, and now I get a thing that says I'm paying $48. Where'd the other 12 come from?
Viewers, I hope that you spend time educating yourself on what your choices are, that you talk to somebody knowledgeable. It's an important topic. It's going to affect your well-being for the rest of your life. This is Rick Lorino for KGPT, Channel 49, South Central Kansas Living.
Thank you for watching South Central Kansas Living. If you would like to select a topic or have a question for Rick Lorino, email us at kansasliving@wichitachannels.com.